Hello, everyone. Welcome to Lakewood Health Systems Well Videocast. My name is Matt Jensen, Director of Marketing at Lakewood. Over the course of the next few months, Lakewood's going to be taking a closer look at the topic of women's health. And today, we're going to be talking about the subject of women's sexual health. Here today to talk with me about this is women's healthcare expert, Carrie Kneisl. Carrie is a certified nurse practitioner at Lakewood. She's also a certified nurse midwife at Lakewood. Carrie, thank you so much for joining me today. It's great to have you with me.
Hi, Matt. Thanks for having me.
So our topic today is sexual health for women. And of all people in the world, you would think that your primary care provider would be a good fit to talk to about any sexual health concerns or problems that you might be experiencing. But by and large, unfortunately, these conversations don't seem to be happening. And in fact, some studies show that between 16 and 43% of women may have a distressing sexual concern or a problem to report, but they simply don't do it. So, Carrie, why do you think these conversations aren't happening right now currently between women and their providers?
Sure. You're completely right. They're not happening. And there are so many factors that go into why we aren't having these conversations. But ultimately, the two biggest factors that I see are, as providers, we're not asking the question, and the patients aren't bringing it up either. So research tells us that about 4 in 10 women experience sexual difficulties at some point in their lives. So we know that it's very common, but women often feel embarrassed to talk to their provider about sexual health. I think it's one of the biggest missed opportunities for patients and providers because talking about sex not only is important for diagnosing and treating those sexual conditions, but also can help us diagnose other health problems as well. And additionally, it'll just assist in establishing that open and trusting relationship with your provider. So what women really need to know is that sexual concerns are so common and they occur for lots of different reasons, but there's lots that we can do to treat them. So as providers, we're getting more comfortable having these conversations with patients, but we also need women to be willing to share these experiences and concerns.
All right, so really just having the courage to bring up the subject, really seems to be a big factor in this. Carrie, as you know, this is a really big topic. We could probably do 10 different interviews about 10 different subjects regarding this, but certainly stage of life can play a huge role in the types of problems women might face. Can you describe for some of our listeners out there what some of the common sexual problems you run into during your practice and just how bringing them up to your provider might be beneficial?
Absolutely. So we see so many sexual health problems in women of all ages. One of the biggest things I see in my practice is lack of desire. And this one concern alone can be due to so many different factors, especially depending on where the woman is in her life. Hormonal changes can have a huge impact on sexual health. So think pregnancy, postpartum, menopause. These are all critical touch points for sexual health. Mental health also plays a large role. So if a woman is experiencing depression, anxiety, increased stress, which many of us experience frequently, especially this year, these can have a huge impact on your sexual health. There are medications that a woman can be taking which can have an impact. Any past history of trauma or current relationship problems can all affect a woman's sexual health as well. Another concern that I see frequently is pelvic pain, and this can be alone or can be something that just occurs with intercourse. This can be due to a lot of factors as well. Common factors include things like infection or pelvic floor dysfunction, which we can use physical therapy to treat. And then some of the other concerns that we see can include difficulty with orgasm or arousal. If you're experiencing any of these concerns, I would encourage you to speak with your primary care provider. During a visit, first we would just kind of talk and get to know a little bit more about your health history. We would probably do an exam and then possibly some lab work if indicated. All of this will help us to find a solution to the problems that a woman is experiencing. Sexual health and wellness are such an important part of women's lives, and we want to do everything we can to ensure that they have a happy and healthy sex life.
Great information, Carrie. Wonderful to hear that, again, these are common issues that many women face. So again, no need to be embarrassed, but I know that's easier said than done. And as I said before, Carrie, it seems to really hinge on being brave enough to start these conversations, start some of these conversations with your provider. So that being said, how would you recommend women broaching the subject with their providers? What are some things that they can do to kind of, kick this off and start that conversation?
Sure. So as a patient, you can just initiate a conversation about sexual health by saying something as simple as, I'm having concerns about my sex life. I don't enjoy sex anymore. or I'm having pain with sex. Once a patient has started the conversation with a statement like that, we will take it from there. We will start asking you all the hard questions and dive in to find a solution to this issue. So I encourage all women to be their own advocate and speak up. Your health is way too important.
So similar to many other healthcare situations, being your own advocate, having the courage to bring it up and have those conversations are really important for women out there today when it comes to some of these sexual concerns. And finally, Carrie, if you are a woman out there struggling with a woman's health or sexual health concern right now, how do they go about finding help at Lakewood?
Yes, we would love to see you and help. The best thing you can do is start a conversation with your primary care provider. And if you don't have one, just go to our website at lakewoodhealthsystem.com. You can read our profile reviews and find the one who suits you best. You can go ahead and schedule online, or you can give us a call at 218-894-1515.
All right, so if you're out there, you're having some struggles, please give us a call. We'd love to get you into the clinic, and we have so many wonderful providers, including Carrie. Feel free to give her a call as well and set up an appointment with her. Carrie, thank you so much for your time today. It's been great chatting with you.
Great, thank you, Matt. We'll see you soon.